So I always get asked questions about what can you do to make the skin look better, to tighten the skin without surgery. And obviously anybody would rather have a non-surgical procedure if possible. The key is just making sure it fits with what you expect out of the treatment. So let's talk about the non-invasive skincare options we have today, which are many. In fact, in the popular press you read about celebrities who constantly have procedures that the lay public thinks they can never attain. Well, there's no secrets out there. So the Madonna lift, the vampire lift, all these different options are available to anybody. It's just that they're popularized, especially with social media, and they go viral, and before you know it, something that sounds exclusive is really pretty basic. So let's talk about the non-invasive, non-surgical options that are available to us today, which are many. I think you need to divide them into two categories. Divide them into the categories that help really tighten the skin and maybe even lift the skin, versus the category where we have wrinkles and folds and lines that we can kind of reduce. So we'll start with skin tightening because that's the most current revolutionary area where we're able to find technology that will actually tighten the skin without injuring the skin. So the first one is something called radiofrequency. And radiofrequency basically drives energy into the skin and just beneath the skin, creates heat, and then stimulates collagen, which then tightens. So that's the basic idea behind radiofrequency, which is good for cellulite, which is good for surface irregularity of the skin. Not really wrinkles, but kind of ripples. And many times people have that either after surgery or even just normally. And these treatments, which require usually 3 or 4 treatments, are fairly successful at doing that. The second category of skin tightening, which is more recent, is ultrasound, targeted ultrasound. And the company that really put that on the market is called the Ulthera or Ulthera company. And Ulthera creates a situation where you can drive deeper heat energy to the deeper portions of the tissue beneath the skin and really create tightening. For instance, it might tighten the area around the jowl or the chin or around the eyes. And it's typically a one-time treatment, although some people will do it again just for increased improvement. And the technique is usually something that takes about an hour to an hour and a half. It's outpatient. You don't need any anesthesia, although some people will put local anesthesia in the skin because it creates a tremendous amount of heat, and the heat is what you feel. And the technique doesn't injure the skin at all, so you can really go out to dinner the next day, you can work out the next day, there's really no downside. So targeted ultrasound, Ulthera, is really the cutting edge of tightening the skin. And it can also be used in other parts of the body, whether it's the loose little lines above the knee or in the arms, and wherever you can tighten skin, you can use Ulthera. So those are the two categories: radiofrequency, which doesn't usually create as much heat and is more superficial, and then ultrasound, which is a deeper tightening of the tissues, a targeted tightening of the tissues. And both those techniques have really had some value over the last few years. Then you go to the other side of the equation, which is trying to improve the surface of the skin. And we've had techniques for that for years, but they tend to become refined. And these are for fine lines and wrinkles. For instance, if we look at a photograph of a patient here, you can see that this patient has folds, but she also has fine lines. She has some wrinkles around the chin, and she has some wrinkles along the neck. So certainly these areas can be improved with some of the new techniques. What are those? Well, there's the standard chemical peels and dermabrasion that have been around for years, but now there's Fraxel laser, and there's also CO2 fractionated lasers. Lasers that don't injure the surface of the skin, yet treat deep, and can help improve some of the fine lines and texture and pigment of the skin. So those techniques have evolved to where the recovery from injuring the surface of the skin to make the wrinkle look better has become less and less downtime. And of course, that's what everybody wants, is less downtime. So you have now these two modalities that are marketed to everyone and are very popular because they are actually marketed to say that there's no downtime. So in looking at these two technologies, you just want to be sure that you're the right candidate for them, because if your expectation is X and it's only going to deliver half of X, you may not be getting what you think. Non-surgical, non-invasive is so easy to market. You just want to make sure that what you're getting treated for is going to really create that improvement. The benefit is, in many cases, it will accomplish what you want as long as your expectations are correct.